Hello everyone, we are from SGD 2 and in this video we would like to present our student project about hypertension without complication. Next, these are our members in SGD 2. So let me introduce myself. My name is Dani Prema with lesson number is 182. Next, so I would like to talk about the background first. So hypertension is also dubbed as the silent killer, where the symptoms are not felt until the sufferer is known to have high blood pressure and there may have been complications that could have resulted in death. Data from World Health Organization in 2018 reported that 1.13 billion people in the world suffer from hypertension, and it is estimated in 2025 there will be an increase in hypertension sufferer to 29.2%. The result of risk assessment in 2018 stated that the prevalence of hypertension was 34.1%, and it has been increased from 5 years ago when Risk-Assessed data in 2013 stated that the prevalence of hypertension was 25.8%. Uncontrolled hypertension can increase the risk of complication, namely coronary heart disease, heart failure, retinal damage, peripheral vascular damage, stroke, and chronic kidney failure. So next, the formulations of problems. First, we would like to talk about the definition of hypertension. Next, what is the epidemiology of hypertension? Next, what is the etiology and risk factor of hypertension? Next, how to diagnose hypertension? Next, how is family interaction for hypertension? Next, how the impact of hypertension to the family? And lastly, how family medicine approaches related to hypertension. Where the purposes of this student project first is to discuss and analyze about hypertension without complication based on validated scientific resource. And the second one is to reach further understanding about hypertension without complication. Whereas the benefits in this student projects, first, as a scientific basis for future research and development about hypertension without complications. And second, to enrich knowledge about hypertension without complications. Next will be continued by my friend. Thank you.
Hello, my name is Wilson Alim, student number 149, and I'll present about the definition and epidemiological data of hypertension. Hypertension is a condition in which the body experiences an increase in blood pressure in systemic arteries. Hypertension can be seen into systolic pressure and diastolic pressure. Systolic pressure can be described as the pressure that arises from the contraction of the heart in the arterial walls. Meanwhile, diastolic pressure is a pressure when the heart relaxes. Hypertension can be caused by two conditions, primary hypertension and secondary hypertension. Secondary hypertension can arise from its underlying diseases, and primary hypertension can be caused by three causes: pharmacological models such as DOCA and L-name substances, environmental models such as flashing light, loud noises, and extreme temperatures, and genetic models such as inbreed, cancemic, and gene knockout that happen or mutate in our cell gene. Recently, researchers found that the prevention in hypertension has been shown to reduce mortality from cardiovascular disease, which make the key to prolonging life expectancy from hypertension. Hypertension is a prevention. Next slide, please. For the epidemiological data, Indonesia itself ranks 6th in Southeast Asia based on data from World Health Organization 2015. Based on riset kesehatan dasar done by Ministry of Public Health in 2013, 25.80% in the population over 18 years suffer from hypertension and still rising until 2018, which data shows significant increases into 34.10. In 2018, 15.5% was found in Bali and lowest percentage in Papua with 16.8%. World Health Organization also estimate that hypertension will increase to 30% of the total world population, or around 1.15 billion people in 2025. Thank you.
My name is Putu Adadani Bramantia with student number 186. There is a need to evaluate the risk factors that contribute to this clinical situation and its prevalence, because the identification of groups at higher risk of being affected by arterial hypertension signifies an important contribution to the prevention of morbidities and effectiveness of the treatment. Among the determinant etiology for the elevation of blood pressures, it is clear that both genetic and environmental factors play an important role in this way. Since arterial hypertension involves these factors, it is classified as a complex and multifactorial disease. The risk factors for developing hypertension are, are divided into modifiable and non-modifiable risk factors. The modifiable risk factors include diet, physical activity, alcohol consumption, and tobacco smoking, and also obesity or overweight. In contrast, the unmodifiable risk factors include family history of hypertension, and age with over 65 years, and the presence of other comorbidities, including diabetes mellitus and chronic kidney disease. The majority of hypertensive patients have modifiable cardiovascular risk factors such as diabetes mellitus, overweight, sedentary lifestyle, smoking habits, salt ingestions, among others. It is then reconsidered to modify these factors to maintain a controlled blood pressure. It is necessary to sensitize the population to adopt a healthy lifestyle, not only a balanced diet and deep and the practice of regular physical activity, but also by frequent monitoring of blood pressure. The matrix process of urbanization has been apparent in changing lifestyle towards becoming more sedentary, and this is worsened by an unhealthy diet, smoking, and alcohol consumption. These are the significant risk factors that could contribute to the development of hypertension among the urban population.
My name is Christopher Yogasa, student number 172. Next is diagnosis. Anamnesis needed for hypertension should asking about signs and symptoms such as headache, epistaxis, irregular heart rhythms, blurred vision, and tinnitus. Next, risk factors such as history of cardiovascular disease, family history of hypertension, patient habit like smoking, alcohol, etc., and previous medical history. Next, history of blood pressure such as the onset of hypertension, previous blood pressure measurement, and history of hypertension therapy. And then causes of secondary hypertension such as renal disease, endocrine disorder, history of pregnancy, obstructive sleep apnea, scleroderma, and the use of drugs that induce hypertension.
My name is Purita Medisrianti, name 081. The next one is physical examination. Check blood pressure using a calibrate sphygmomanometer. Hypertension if blood pressure systolic more than 140 and or diastolic 90. Blood pressure measurement should be done 2 until 3 times examination within 1 until 4 weeks. Position should be sitting with the arms at heart level, back is relaxed, legs are not crossed on the floor. The patient should not speak and taken at least 5 minutes after sits. Place an inflate cuff until the radial artery position not palpable. The stethoscope on brachial artery. Deflate the cuff slowly 2 until 3 mm of mercury per pulse. Systolic, chord cuff 1, the first pulsating sound heard, and diastolic, chord cuff 5, the last sound heard. This is the classification of hypertension by GNC8. And the next one is criteria for hypertension based on office, ambulatory, and home blood pressure measurement. Other physical examination can be done to evaluate target organs for secondary cause or possible complication. Anthropometric body mass index, waist circumference for obesity. Neurologic if clinically symptomatic stroke is present. I, because hypertension can cause damage to the fundus ecoli and St. Thomas. Congestion sign in the heart failure can be found increased jugular venous pressure, fine red crackles, hepatomegaly, and pitting edema. Left ventricular enlargement may be suspect if the apex is palpate laterally on cardiac palpation. Pulse, peripheral arterial disease can be characterized by weakening or even loss of peripheral pulse.
Good morning, Dr. Friends. My name is Ayu Milana Santoso, number W07. I will present about the other examination for hypertension. So laboratory examination for hypertension is not necessarily used if hypertension itself don't have any additional risk factors. So laboratory examination are used to confirm or exclude secondary hypertension or detect any clinical or subclinical target organ damage. There are some written tests that are usually used, such as hemoglobin and hematocrit, high-density lipoprotein cholesterol, fasting serum triglycerides, serum potassium and sodium, serum uric acid, serum creatinine, estimated glomerular filtration rate, urine analysis, including test for microalbuminuria, 12-lead EKG. There are some additional tests based on history, clinical examination, and routine tests such as hemoglobin A1C, quantitative proteinuria out of office PP measurements, echocardiograms, Holter monitoring, carotid ultrasound, abdominal ultrasound, pulse wave velocity, ankle brachial index, and further specialist tests for secondary hypertension. So there are some specific tests for secondary hypertension, such as primary hyperaldosteronism, renal parenchymal diseases, and increased catecholamine level that indicates there are secondary hypertension.
My name is Cynthia Sudana with the last number 23. I'll be presenting the differential diagnosis of primary hypertension. To confirm the diagnosis, other diseases must be ruled out first, such as 1. Secondary hypertension that can be caused by various things, which is renal causes, endocrine causes, and others, such as obstructive sleep apnea, drug-induced hypertension, and also pregnancy. Secondly, there's primary aldosteronism. In patients suffering from primary aldosteronism, there were significant structural abnormalities in the left ventricle and impaired insulin secretory function. Thirdly, there's correction of the aorta that has a distinctive characteristic, which is the difference in blood pressure in the upper and lower extremities. And fourthly, there's renal artery stenosis. Patients with renal artery stenosis usually reveal an abdominal bruit and a flank bruit. Lastly, there's chronic kidney disease. Patients often complain of flank pain, nocturia, decreased urine output, the appearance of foamy urine, and also even hematuria. Thank you.
So hello everybody, my name is Lalita Samalu, student number 156, and I'll tell you about the family interaction for hypertension. Hypertension is one of the chronic degenerative diseases. As a result of the length of the disease suffered by the patient, a family has an important role in the management of the disease. In hypertensive patients, checking blood pressure regularly is an essential thing to carry out. The COVID-19 pandemic has led to a decrease in compliance among patients against regular control. Therefore, support from the family was needed by the patient to conquer the feeling being felt during the pandemic. It can improve the compliance with the treatment and aid the patient in the process to control blood pressure. It is found that support from the family has a significant correlation to the quality of life and anxiety. Furthermore, it can prevent the occurrence of hypertension in adolescents with health education, mentoring, and monitoring program empowerment, such as preventing their children from smoking, providing information about hypertension, and etc. According to the research conducted by Rusdianix in 2021 in Surabaya, it can be classified into 4 themes regarding support from the family. The first one is emotional psychological response. The second one is financial support, like the form of the purchase of medicine, medical expenses to healthcare centers, and other needs related to patient recovery. And the third one is instrument support, such as procurement of blood pressure check tools and other needs. And the fourth one, or the last one, is family expectation, such as great hopes from the family for the healing. Thank you.
My name is Christopher, student number 153, and now I will present about the impact of hypertension. Family history of hypertension increases a person's risk of developing the condition by over 1.4 times compared to someone without one. Previous studies from several nations have revealed comparable elevated risks, where those without a family history of hypertension were 2 to 4 times more likely to acquire hypertension than those without one. Family history as a risk assessment strategy is an amazing tool because it provides low cost, higher accessibility, and capacity to represent common genetic lifestyle variables. The consequences of untreated and ineffectively managed hypertension is tremendous on a medical, financial, and human scale. This is mainly caused by the continual cost of hypertensive medicine, which makes it hard for families to adhere. In another study, patients report that their emotional function had significantly decreased following diagnosis of hypertension.
My name is Anna Agong Aivida Indari, student number 232, and I'm going to explain about family medicine approaches related to hypertension. The first one is comprehensive approach. So the role of comprehensive family doctor approach here is to prioritize patient-centered, detecting internal and external factors that can cause the disease, hoping that family approach might improve the patient's quality of life. Patient-centered approaches can be done by giving education about hypertension itself, education about taking medication regularly, education and motivating patients for reducing their weight are also needed. Family approach intervention can be done by giving the patient's family information about hypertension itself, the risk factors, dietary interventions, prevention, therapy, and also complications. And the most important thing is educating the family to support the patient's new lifestyle, including diet pattern and giving motivation for building the better condition for the patient. Thank you.
So the next is collaborative approach. Team-based care, including the physician-pharmacist collaboration model or PPCM, is one of the most effective strategies for improving blood pressure. The physician-pharmacist collaboration model or PPCM incorporated pharmacies and interventions included a medication history, assessment of knowledge of BP drugs, dosage and timing, and potential side effects, other barriers to blood pressure such as side effects and non-compliance. A pharmacist will create a treatment plan that includes recommendations for doctors to adjust the treatment. This model recommends upon call after 2 weeks and structured face-to-face visit at baseline at 1, 2, 4, 6, and 8 months, with additional visits if blood pressure remains uncontrolled. Next is continuing care approach. A key feature of primary care system services is continuity of care or COC, defined as recurring care provided by the same physician. Continuity of care is associated with lower mortality and hospitalization rates and better control of hypertension. When patients are treated by the same physician over time, they form beneficial therapeutic relationships, increase patient satisfaction, make more patient-centered intervention, and improve health outcomes.
My name is Ana Agung Aifidia Penyandari. This is number 232, and I'm going to explain about the prevention of hypertension. So the prevention of hypertension can be classified become primary, secondary, and also tertiary. So primary preventions are lifestyle modifications as the actions that can be taken prior to the onset of hypertension, such as avoiding high salt diet, maintaining normal body weight, limiting alcohol consumption and also smoking cessation, consume diet rich in fruit and vegetable, engage in regular aerobic activities, and also reducing consumption of saturated fat. The secondary prevention are the actions that prevent complications through early detection and proper management. So these are including lifestyle management, blood pressure screening, and also treatment for complications. And the last one is tertiary prevention, which are actions that focus on limiting the disease progression and clinical complication. This can be done by lifestyle modification and also treatment of hypertension itself and any possible target organ damage. Thank you.
Hello relatives and friends, my name is Mara Humeriantiza with the number 061. I'm going to explain about the summary of this paper. So hypertension is a major health concern worldwide. It can be caused by modifiable risk factors such as diet, physical activity, and alcohol consumption, and also smoking. And also non-modifiable risk factors like family history of hypertension, old age above 65, and comorbidities like diabetes and kidney disease. History taking and physical examination should be done to diagnose hypertension, and it can be considered so if the patient's systolic blood pressure is 140 or above, and diastolic blood pressure is 90 or above. During the course of the disease and the treatment, family support can impact the process a lot. It can be done by a comprehensive approach like lifestyle interventions and education about hypertension to the family, and also collaborative approach involving a team-based care with physician and pharmacist collaboration model. High blood pressure can be prevented by primary preventions such as lifestyle modifications, secondary preventions like regular BP screening, and tertiary one focusing on avoiding the complications of the disease. Next.
Hello everybody, please introduce myself. My name is Jerry with my last 3-digit student number is 094. So our suggestion to the family and to the patient is the first one, the family should give moral, emotional and psychological support to the patient to help them cope with hypertension as well as reducing the level of patient stress. Number 2 is the family should provide financial support regarding the cost of the patient's treatment during the course of the disease. Number 3, the family should give good and adequate nutritional support to the patient. And the last one is the family should provide instrumental support such as blood pressure measurement tools and perform regular blood pressure checkup at home to the patient. That's all from our student project. Thank you for your attention.